Well, hi there, everybody. It is Dr. Steve, and this is Understanding Your Pain. And today we're talking about an ankle sprain. So, very common to roll an ankle, especially lots of sports, but it doesn't have to be sports. You can be walking anywhere and step onto a crack and then accidentally roll the ankle. The typical presentation is where we roll to the outside, or we call that an inversion sprain. But what ends up happening is we kind of stretch and strain those ligaments on the outside part of the ankle. Typically what we'll see is the ankle balloons up, it swells up, it might get black and blue depending on the severity, but it's pretty tender to walk on, and we see people kind of hobbling around. In the typical presentation when you sprain the ankle is that the body will adopt a position, if it was my right ankle, of wanting to turn the foot out as you're kind of hobbling along to make it easier, because one of the big things that happens with an ankle sprain is we lose dorsiflexion. So dorsiflexion is where the shin bone is kind of bending, the ankle and the foot and the shin are coming closer together. So dorsiflexion is this primary motion that the ankle is supposed to do, that it needs to do. With an ankle sprain, that often gets stuck and restricted, and that can be one of those limitations that cause problems down the line. So we want to make sure that we work on that. The first thing that you want to do if you have an ankle sprain is there's the R.I.C.E and M.E.A.T acronyms. So R.I.C.E is the rest, ice, compression, elevation. Now, if you can get down and put your legs up onto something so that you're elevating it, they are up above your heart, and then doing some just little ankle motions, some pumping back and forth, doing some circles each way, doing the alphabet. A lot of little ankle motions with the legs elevated helps gravity drain some of that inflammation and swelling. So that's rest, icing, put some ice on it. The compression, wrapping it around just a little bit snug, is helpful, and the elevation. So that's the first acronym of R.I.C.E. Then there's M.E.A.T. That's M for movement. We want to get the rest of the body moving as much as you can. Early protected movement helps stimulate the healing process. E for exercise. You want to just get the rest of the body exercising. If you can go on an arm bike or maybe do one of the kind of skiing ergs, but getting lots of exercise with the rest of the body while protecting the ankle is huge. And then we have M, movement, exercise, analgesics. A for analgesics, you just want to manage the pain. And then T for therapy. So for current injuries like an ankle sprain, R.I.C.E, rest, ice, compression, elevation, and then M.E.A.T, the movement, exercise, analgesics, and therapy. So as we start into getting things working again, using something like a tissue, and you're going to wad the tissue up, and you can start with this seated if you want, but where you're going to be using the toes to grip the tissue, pick it up, and then drop it back down. Doing a bunch of gripping with the toes makes a big difference to move that swelling out of there and get things moving in the right direction. It turns on those muscles. So you can do that seated. You can also do that standing, and that can be a good exercise in itself, where you're gripping, picking it up, and setting it back down. So that's the one thing. The first thing to do is going to be some tissue pickup with the toes. Now we're going to do one more thing here in the beginning, which is going to be some squats in a bunch of different positions, where you need to listen to the body about how far you can go and how deep you can go with it. It all depends on what feels good, and we want to minimize pain. So we're going to start with the feet hip width apart, toes pointed forward, and just have you drop into a couple of squats as best you can. And then here's where it's going to get a little bit different. We're going to change the feet around. Then I want to have you go a little extra wide, doing some squats. Then you're going to bring the feet together a little extra narrow. and go through, do some squats. And again, we want to be listening to pain the whole time, so you don't want to force yourself into pain, but you want to work as much of the range of motion that you can that's pain-free. We go back to hip width apart, and then we're going to go toes out, do a few squats, and then here's where we're getting into the positions that are a little bit tougher for a sprained ankle. Angling toes in as best you can and going through some squats. Now, when the toes are angled in, we run into the limits of the joint sort of motion. By the structure of the joints and the way that they're designed, we don't get as much motion as we internally rotate the toes. That's okay, you just do the best you can. And then the last couple are, we're going to do 1 foot forward, 1 foot back. So the foot that's in back is getting a whole lot more of that dorsiflexion bending at the ankle. So that's one of the tougher ones. If it was my right ankle that was sprained, the left foot forward is where the right foot is back. That's where we're asking the most of that right ankle. And so if I give you that side view, trying to keep the heel down and just bending, because we're trying to get this shin as far over the toes as you can to let the ankle dorsiflex. And that's one of those motions that gets stuck from an ankle sprain. So we're going to keep building on those. So be sure to tune in for parts 2 and part 3 as we go into a little further with these ankle sprains, understanding your pain and figuring out what to do about it. If you or anybody that you know has sprained their ankle or struggling with a foot and ankle pain, don't let them sit home and suffer, but send them into Kineci. Let us figure out what's going on so we can help and come up with a plan to move you forward. So be sure to stay tuned for the next one. And until then, keep moving, everybody.